Good morning, everybody. I don't have any COVID-related updates or issues today. I just wanted to take a minute and thank everybody who joined us yesterday to honor Everett Police Officer Dan Rocha. It was a moving ceremony, a really heartbreaking day for the family and the community, but it was also really humbling and gratifying to see the amazing outpouring of support and love from everybody in the county, the region, across the country, and even British Columbia. So just thank you for supporting Officer Rocha's family and our community. He was an extraordinary man. I think if you listen to the eulogies, he was a very special guy, and he is gone, won't be forgotten. So thank you for honoring him. With that, I'll hand it off to Dr. Spitters. Thank you.
Well, thank you, Executive Summers, and good morning, everyone. So turning to COVID-19 topics, for the second consecutive week, Snohomish County saw another 30% increase in reported cases during the 7-day period ending last Saturday, April 2. 498 cases were reported, up from 376 during the week ending March 26, and 290 during the prior week ending March 19. The corresponding 7-day case rate for last week was 60 cases per 100,000. New hospital admissions for COVID remain less than 5 per 100,000 per week, and the hospital's COVID census is less than 10% of beds, leaving Snohomish County still in the low COVID-19 community level per CDC's monitoring framework. However, the recent increase in cases is concerning and warrants ongoing monitoring for continued increases and/or impacts on hospitalizations. The Omicron Subvariant BA2 has been displacing the parent Omicron strain as the dominant strain in Washington. It now accounts for over half of all cases in Washington state and in the nation. Although total cases are relatively low compared to the high numbers we see during the peaks of COVID waves, our estimate of the number of BA2 cases appears to be steadily increasing over the past several weeks, both in Washington state and nationwide. We are likely at the front end of a wave of BA2 cases. This wave is currently low impact, and it is likely to play out over the coming weeks and months as we progress through the spring. There's no strong signal that BA2 leads to increased severity of illness compared to Omicron, nor that there is increased immune escape compared to Omicron. As I shared several weeks ago, the impact of BA2 is likely to be buffered by current high levels of immunity gained from vaccination or from prior infection acquired during the Omicron wave. It seems unlikely that we will witness the overwhelming number of cases and healthcare impacts that we experienced throughout the Delta and Omicron waves. Still, the duration, peak, and ultimate impact of the emergence of BA2 does remain uncertain. However, there are some things we do know. First, completing vaccination and getting boosted when appropriate greatly reduces the risk of severe disease, hospitalization, and death. Wearing a well-fitting mask indoors and maximizing ventilation reduces the risk of transmission in indoor environments. Masking is currently optional in most public indoor settings, but is required in some spaces. Remember that any organization, enterprise, or venue is free to require mask wearing by its staff and patrons. Staying home if you feel ill and getting tested helps reduce transmission to others. And those who test positive and are at high risk for severe disease can benefit from oral antiviral treatments or injectable monoclonal antibody treatments to reduce the chances of hospitalization. If you think you might qualify, please speak to your healthcare provider first and get a referral in order to receive monoclonal antibodies or oral antivirals, as well as some preventive monoclonal antibody combination that's available to severely immunocompromised people. So it's been more than 2 years since COVID arrived in Snohomish County, and in that time, much has changed. We now have tools that were not available to us when the pandemic started, including vaccination and the therapeutics I just mentioned that greatly reduce the loss of life from this disease. But COVID is not going away, certainly not right away. Collectively, we're going to have to learn how to live with the ebb and flow of cases as time goes on. This means our community must be ready to increase prevention measures like masking or social distancing when the level of transmission or the trajectory of it impacts, the trajectory of its impacts warrants doing so. Public health continues to monitor the situation, and people should stay tuned for updated recommendations on prevention measures like indoor masking and social distancing as time passes. Meanwhile, if you haven't done so already, please complete your initial vaccination series and do stay up to date on boosters. A reminder that at the end of last month, the Food and Drug Administration extended the emergency use authorization for Pfizer and Moderna mRNA vaccination to include a second booster, that's a fourth dose overall, for people ages 50 and up, as well as for certain immunocompromised individuals. If you qualify, you can schedule your second booster at your local clinic or pharmacy. These vaccines continue to be available free of charge. If you are not certain whether you qualify for a second booster, please talk to your healthcare provider. Before I wrap up my comments for today, I'd also like to mention that this is National Public Health Week. Over the past couple of years, public health has become more visible in the light of COVID. However, there's a lot more that's happening in addition to the COVID response. The work of public health in Snohomish County includes environmental health efforts to keep our food supply safe and our water clean and to reduce pollution, providing access to vital records like birth and death certificates, tracking and preventing many diseases in addition to COVID, like tuberculosis, sexually transmitted diseases, and vaccine preventable diseases like measles, mumps, or whooping cough. We also are involved with reducing overdoses and substance use disorders, addressing mental health concerns and suicide prevention, improving access to dental health care for children, and working with child care providers on health and safety in child care settings. And those are just a few of the variety of important activities happening here at the Health District. I want to thank all of the staff at the Snohomish Health District for their dedication to this work. It's an honor to work with them. And with that, I'll turn it back to you, Executive Summers.
Thank you, Doctor. The first question was, does the county still have federal or state COVID recovery funds undistributed? If so, how will that be spent? Well, from the county's standpoint, yes, we received the first tranche of federal dollars for the American Recovery Act this last year. That was $80 million, and we will be getting the second tranche of $80 million next month, I believe. And we have a number of years to spend that, but we've been focused on still response with the first tranche, but we're moving more towards long-term recovery. And that includes looking for opportunities to work with our cities and communities, fill their needs throughout the county. Some cities did receive dollars also, and we're working with them, meeting with the mayors, looking for opportunities to have long-term sheltering and housing available within the community, helping businesses, small and large, be more resilient going into the future. So we do have an Office of Recovery at the county that's planning and working with the council on how to distribute those dollars, but we're in the middle of that. And if you'd like more detail, I'd be happy to get it to you, just exactly what's been allocated and what is not. But Doctor, do you have any additional?
Well, just a reminder to folks that as the FEMA funding that funded our vaccine and testing sites has sunsetted, so have the operation of those sites. Our Ashway Park and Ride testing site was handed off to University of Washington, so there is still drive-through testing at the Ashway Park and Ride. But the vaccination and other testing activities have been all transitioned fully to the healthcare system. And our role going forward is to focus on these things I was talking about today: monitoring the course of the pandemic, making recommendations to the community about how best to protect themselves, and then, of course, engaging in planning with our government and non-government partners about contingencies if things, make a U-turn and we have more problems.
We had a question, what percent of people are now vaccinated in the county and how many have gotten a fourth shot?
Sure. Well, countywide, it's of those who are eligible, which is everyone over 5 years of age. It's in the low 70s. It's right around 72%. I think have had at least 2 doses of an mRNA product or 1 dose of the Johnson & Johnson product. That's roughly 530,000 people or so, I believe. And of those, about 300,000, just over half, 55% or so, have gotten an additional dose. And the 4th dose option, the second booster for folks over 50 or immunocompromised individuals, has really only been out there for a week. Last week in the county, I think 6,500 doses were given to Snohomish County residents total. Probably the majority of those were 3rd or 4th doses. So that's the 4th doses is just a touch so far. And that's just getting rolling. But overall, as I said, just only over half of people eligible for a booster have gotten it. And that booster is very important for broadening the ability of our body's antibodies to detect different variants, as well as to give us a nice high concentration in our blood of antibodies. So that's still strongly recommended going out for everyone who's eligible for a booster to go out and get that done at some point, certainly before the fall. And if we see things continue to increase, doing it now would be better.
Okay. And Bob, yeah, we'll get you hooked up with the information on the COVID recovery funds. Any other questions? Any more questions? Anything?
Thank you all. This is Carrie. I'm going to hang out just 1 more minute, make sure we're not missing someone who's still typing. But if there aren't any more questions, we'll wrap up in just a minute. Okay, I know that wasn't a full minute, but not seeing any more questions popping up, we will go ahead and wrap up this media availability. Please do stay tuned. We will send future media availability notices out through this list. So we will see you again in about a month or sooner if there is another update needed. Thanks again for joining us today, and we'll see you soon.